Once upon a time, there was a girl who lived in the magical land of Dane County, Wisconsin. She had boundless energy and loved to play outside. The girl grew to be a teenager, and she still loved to play outside. Then, as depicted in this quality reenactment, the girl became ill. Maybe this reenactment seems a little extreme, but I am that girl, and I can vouch that that is pretty much what it felt like. What had made me so sick?
Ticks are animals. They're invertebrates, they're arachnids, so in the adult form they have 8 legs. They live in wooded areas, grassy areas, and they eat blood. There are a lot of different kinds of ticks. In Wisconsin, the 2 most common types are the Ixodes tick, which is Ixodes scapularis, which is known as the deer tick or the black-legged tick, and the dog tick, which is the Dermacenter genus. Those are much bigger. The deer ticks are the small ones. The nymph stage of the deer tick, which is the one that carries Lyme, is about the size of a poppy seed, making it almost impossible to see. The adult stage is considered to be about the size of a sesame seed, which is a lot easier to see, but nowhere near the size of the more familiar dog tick, which is, when it's not engorged with blood, flat, but about the size of a split pea in diameter. Probably not. It seems that many species of the genus Ixodes do, but other types of ticks, including the larger dog ticks, don't seem to. In most human patients, the most serious effects are in the joints, particularly the large joints, the elbows and knees, and then also in the nervous system. So it can enter the nervous system, affect the brain, the central nervous system, cause pain in nerves, and even cause disorders of mentation, so actually affect brain function. The other symptoms of the disease, because it's in the blood, it can go anywhere. It can affect kidneys, cause kidney damage. In most patients, the symptoms they feel initially are going to be pain in the joints, and some people will report fever and just a general feeling of illness, but not all patients seem to feel that. Sometimes they just feel fatigue or malaise.
Those symptoms could fit the bill for anything from influenza to multiple sclerosis. It's a good thing that with Lyme disease, you at least get a distinctive bullseye rash to let you know whether you're sick with Lyme or not.
So that used to be thought of as a bullseye pattern, but actually it could be any red sort of spot or red area on the skin. I actually was reviewing this recently, and some research suggests that somewhere between 9 and 50% of humans get the rash. So what do you do if you find a tick on you? Well, if it's walking around and not attached, then you take it off. You don't flick it, because they can live for quite a while and they will walk around and get back onto you or somebody else. So you have to grab it, and you should make sure that it is killed. If you find an attached tick on yourself or your pet, it needs to be removed very promptly. The best way to remove it is with tweezers and grasp it near the skin and just pull straight out. At that point, it's still alive, so you still have to kill it. So 2 things. You will not detach the head. Ticks do not have detachable heads. However, there will be a bump left in the skin in the dog or the person if the tick's been attached for any amount of time, because when they bite, they basically spit some of their saliva into the open capillary of the person or dog in order to anticoagulate, to make the blood keep flowing, because they're going to be attached for 24 to 72 hours to get a good blood meal, and also a numbing agent, a local anesthetic, so the patient doesn't feel the tick on them, which is a little disturbing. And generally the skin will have a little bit of reaction to some of those substances. So there'll be a little bump. Some of the jaw parts might get torn off when you pull the tick out. That is fine. They are tiny and they will not cause you any trouble. So don't worry about leaving anything in, just pull the tick out. It is bacterial, which is very, very important. So the bacterium is Borrelia burgdorferi, and that is very, very important because, of course, bacterial infections can be treated with antibiotics and viral infections cannot. So Lyme disease in humans and animals is treated the same way with antibiotics. The 2 antibiotics of choice are doxycycline or amoxicillin, which is one of the penicillins. Doxycycline is not.
If life gives you lemons, make lemonade. If ticks give you Lyme, get on antibiotics.